Okay, I'm going to perform a quick postpartum assessment. Before beginning, I would knock on the patient's door, perform hand hygiene, and introduce myself. My name's Jordan. I'm going to be your student nurse today. We're going to get started. So first, I would start by performing the patient's vital signs. I would take her temperature orally, and then I would check her pulse, and as I check her pulse, I would do her respirations, and then I would do her blood pressure, and then I would ask her, are you in pain? Are you in any pain right now? She's not in any pain. Okay. So moving on, we're going to do her breast examination. So if she had a gown on, I would remove the gown from the top to expose her breasts to provide privacy. So as I assess the breast, I'm going to ask the patient if she's having any soreness or discomfort. Are you having any soreness or discomfort? No, she is not. When I assess the nipples, I'm going to be looking to determine if the nipples are intact. So I'm going to be looking for any bleeding, any blisters, redness, and so forth. As I look at the breast, I'm going to also be noting the size, the shape, any engorgement or abnormalities. And then I will palpate the breast lightly in a circular motion. And then after that, I would cover her back up so her breasts are not exposed. And then I'm going to listen for her bowel sounds now. I'm going to start in the right lower quadrant. Can I lift up your shirt just a little bit? You can pull it back down. Now I'm going to take a listen for her breath and heart sounds as well. I'm going to take a listen to you, okay? Now I'm going to assess her fundus. So can I lift your shirt back up just really quick? Okay. One hand I'm going to support the uterus, and then the other hand is the hand I'm going to palpate the abdomen with. When I assess the fundus, I'm going to be looking, is it firm or bulgy? I'm going to be looking if it's displaced or at midline, and if it's above or below the umbilicus. Her fundus is firm, it's at midline, and it is +2 above the umbilicus. Now I'm going to ask the patient if she has peed since delivery. Have you gone to the bathroom since delivery? Yeah. Did you have any pain? No? Okay. Have you gone poop since delivery? The common answer is no. It may take women a couple days after delivery. Are you passing any gas? Are you passing any gas? Yes, she is. Now I'm going to assess the patient's lochia. So I'm going to be checking the patient's peripad. When we assess lochia, we're going to be looking for the color, amount, if there's any odor or blood clots. We grade lochia amount per hour, so if the patient hasn't changed her peripad for 2 hours, then we would cut that amount in half. As I look at the patient's lochia, the color is rubra. There's a moderate amount. There's no odor, and if there was odor, that would indicate an infection, or could indicate an infection, and there's also no clotting. Now for the episiotomy, when I assess the patient's episiotomy, if she had one, I'd be assessing the perineum, so I would have the patient turn to her side, so it exposes the perineum. I would be looking to see if there's any edema, if there's any redness, drainage, and so forth, and then I would also be checking for approximation. And then after I check for that, I would have the patient turn back on her back or sitting up, however she would like. And then lastly, I'm going to assess the patient's extremities. So I'm going to be assessing if there's any edema, redness, warmth, or if she's having any pain in her legs. For the Homan sign, I would dorsiflex the patient's foot. So I would just push it that way. Push it that way. And then lastly, I'm going to assess the patient's pedal pulses. And both of those are equal bilaterally. All done. Say bye.